And we are different in the Washington region than the rest of the country in many respects, because if there's a tremendous budget cutting in the federal government, well, that will specifically hurt Northern Virginia, which has become the headquarters of federal spending, military and consultant spending. How do you protect your own congressional district if you're going to be cutting the budget, Mr. Fimian? I think I asked you this when you were here a few months ago. It's against your own interests.
Government can operate more efficiently, and we got to engage the federal worker to do that. I'm worried about my country. My country's in trouble because we're overspending at a hyper rate. Mr. Connolly says that we got to stimulate demand. You're not going to stimulate demand. What you've got to do is reduce uncertainty. He talks about the Clinton and what Clinton and Bush did. Look, what matters is what he did. He voted for $3 trillion in new spending. He voted for $670 billion in new taxes. He voted to increase the deficit to 40% of the federal budget. It's the same as you and I running out of money in our household on the 20th of the month and using a credit card and going out every night for the remainder of the month to the most expensive steakhouse in town.
But on the concern that if the government does cut back, and I'm not saying it should or should not, I'm just saying, won't that affect the economy of Northern Virginia? Are you worried about that at all?
Let me make it even more specific, because everybody
but not
who's
more
listening,
complicated, because I made a very simple question.
Everybody who's listening to this broadcast knows that one of the largest employers in your district is the federal government. There's a conversation taking place right now about whether federal workers are paid too much. Even the president has engaged on this issue. Where do you stand on salary levels for federal employees, and what issues do you plan to advocate for federal workers in the next session of Congress?
Look, I would engage the federal worker. They are an immensely talented group of people. They know their job very, very well. Their boss, political appointee doesn't, but they do. And in the private sector, what gets incented gets done. Kojo, what I would do is I would incent these people to find efficiencies in government and reward them for doing so. Give them 5 or 10% of the savings they come up with. In my company, if we have 20 people in a department and one leaves, we ask the other 19, you can replace or not. If you don't replace, we'll split the savings with you for 1 year. Year 2, the company gets 75%, you get 25%. We hardly ever replace as a consequence of that. If there's 1,000 people in a federal department and 40 leave 1 year, why not say to the other 960, if you do not replace these jobs, we're going to split 20 of those salaries among you. If you do that 5 years in a row, you watch what happens. What gets incented gets done. And the reason that's so visible in the private sector is that margins are so thin.
Some of your fellow Republicans have pushed efforts to freeze or cut the federal workforce and its compensation. Do you agree?
No, I don't. I don't think you have to. I think you do what I say, and you can have your cake and eat it.
I want Congressman Connolly to answer the question about the danger for Northern Virginia, your congressional district.
I think my opponent actually represents a real and present danger to the economy in Northern Virginia with his national partisan talking points about federal spending. Not all spending is the same. The partnership that has taken 30 years to build between the federal government and the private sector in Northern Virginia has created the second largest information technology community in the United States, next only to the Silicon Valley. It has absolutely created our quality of life and our economy. I represent the highest median household income in the United States, number 1 out of 435 congressional districts, hundreds and hundreds of thousands of jobs. Kojo, not only direct federal employment, but federal contractors, indirect federal employment, and related employment. And so you have to tread carefully on this relationship. I think it's been a win-win for the federal government. And to simply come in with a meat axe saying, I just want to slash federal spending, is going to have a lot of collateral damage, especially in Northern Virginia. I think you have to do it with a scalpel. I think you have to do it carefully. And I think you have to protect what we worked so hard to build in Northern Virginia. I come from that community. I'm on the relevant committee that advocates for federal employees and for a reasonable approach to federal contracting. And my opponent has yet to ever address anything.
I'm not in favor of cutting with a meat axe, but let me tell you, what threatens the Northern Virginia economy the most is the overspending Mr. Connolly is engaged in, period. You can't borrow 40% of your operating budget, which is what we're doing. That cannot be sustained. This affects everything. People are going to be looking for cuts everywhere because of the incredible spending Mr. Connolly has added to the federal budget in the short time he's been in office.
I would only point out that my opponent yet again has failed to answer the question you put to him. What about the economy of Northern Virginia?
Look,
if you become elected, Keith Fimian, would you also join the House Oversight and Government Reform Subcommittee on the federal workforce?
I would like to. My predecessor, Tom Davis, sat on that committee and chaired it. But again, the spending is a real threat to everyone, Kojo. And Mr. Connolly is making light of it as though somehow what he's voted for doesn't matter.
No.
I mean, what he has done is unconscionable, quite frankly. There's a $30,000 debt on every child born today.
In case you're just joining us, there's Keith Fimian. He's a Republican candidate for the U.S. House of Representatives running for the seat representing Virginia's 11th congressional district. That seat is held right now by Jerry Connolly. Gerald Connolly is a Democrat, also of the 11th district, up for re-election next Tuesday.
Kojo, I just want to say, by the way, the question on what committee would you like to be on, at that program that we won't name that we were just on,
yes,
his answer was, I'd like to go in the House Ways and Means Committee.
Well, I
wasn't oversight and government reform.
My answer. Listen, you can serve on more than one committee. If I had my dream job, it'd be Ways and Means. The odds of that are pretty small for a freshman congressman. Let's face it. So I'll settle with House Government Reform and Oversight.
Settle? I proudly joined that committee.
Well, listen, compared to Ways and Means, I mean, I'd love to be on Ways and Means.
Here are our listeners. First, Gabe in Fairfax, Virginia. Gabe, you are on the air.
I'm calling because I have a father who has diabetes. I have a grandfather who passed away because of Alzheimer's disease. And stem cell research is one of the few ways that looks like it's going to be potentially to solve these diseases and make life better for millions of Americans. I would like to know what the candidates' positions are on stem cell research.
First, you, Keith Fimian.
I am strongly in favor of stem cell research. It offers enormous promise.
Embryonic stem cell
I'm not in favor of embryonic stem cell research. The adult, which shows no promise to date. Adult stem cell research shows enormous promise. That's where all the discoveries are being made, and with the ethical concerns having to do with embryonic stem cell, my point is if it's so ethically challenged to many people, then why engage in it when this other adult stem offers such great promise?
Jerry Connolly.
Well, I think this is another example of the sort of obfuscation by my opponent, who doesn't want people in this district to understand just how radical his views are in so many of these social issues. I favor embryonic stem cell research. That's the research that has the promise to try to cure Gabe's relative of diabetes and so many other human illnesses. And quite frankly, I think that is an ethical decision. Not to engage in that research, I think, closes the door on solving an incredible challenge for human health.
Once again, Kojo, it shows no promise right now.
There's not a scientist in the world.
Social issues. Can we get to a couple of social issues? Or do you
Well, one more question on this. Bertrand sent a question to our website for Mr. Fimian. Did you or did you not specifically change the health policy of your employees so that a woman with an ectopic pregnancy, which when left untreated kills the mother and the fetus, would not be covered?
No, that's not true at all. In fact, it's point blank untrue.
Okay, Tom Sherwood.
Well,
can I just say something about that? I don't believe that is true. That is to say, I don't believe my opponent's answer is true. We actually had one of his employees 2 years ago provide us with the insurance coverage, and his addendum to it explicitly amending the insurance coverage to make sure that that would not be covered.
That is patently false. Listen, what we do, our insurance plan we crafted early on, we wanted one that would cover our employees with the most common ailments, but one that didn't cost us more. I mean, when you're starting a company, Kojo, it took me 8 years before I had enough money in the bank to make today's payroll and the payroll 8 weeks from now, or 2 weeks from now, rather. I lived 8 years hand to mouth. You're looking at cost cutting everywhere you can find it. The truth is, our plan now is completely comprehensive.
Well, I don't know the plan, but let me ask you the general national policy question, which you guys could vote on, would be a proposal to repeal the health care reform that was passed this past year. Would you vote to repeal it and start over?
I would, Tom.
Mr. Fimian, you would.
And the reason is because it doesn't cover your health. It doesn't address wellness adequately. It doesn't give an incentive for, there's no difference between a 22-year-old marathon runner and an overweight smoker. It doesn't address insurance across state lines.
I don't want to get into all the details of
address
the health
savings
kind of
accounts.
But
these are the reasons I oppose it. These are relevant.
I know, but the bill is so, what is it, 1,000 pages?
2,300 pages.
2,300 pages. I don't want to start down the list of the context.
No, I would not repeal it.
Would you fix some things?
Of course, everything. I mean, we're still fixing Social Security. I mean, legislation is always a work in progress. But I believe the health care reform bill is going to make a meaningful difference in people's lives in terms of a huge basket of reforms. And I think it's going to bring down the cost curve of health care, which is desperately needed.
Can I go to a quick social issue again? I just want to
But
run
I
through.
don't want to go away from healthcare quite yet. Before you go away from healthcare, let me ask Mr. Connolly, since he approved of the bill that the president ultimately signed. Can you make a case for how that bill has already affected your constituents?
Yeah. All kinds of constituents now can have peace of mind in terms of their kid being on the policy till 26, that it's going to be illegal for health insurance companies to deny them coverage based on a pre-existing condition, that we're closing the donut hole for senior citizens in their drug coverage, and next year they're going to get a 50% discount on brand drugs.
Are those things you're against, Mr. Fimian?
Not in their entirety, but look, it's important. Connolly said we had to pass this bill, or Nancy Pelosi, so that we could read it, so that we could know what's in it. How wise is that? Look, 2,300-page bill. Think about it. It's self-referential. I mean, I tried to read some of the earlier versions. This bill does not do what we need it to do. There should be at least 4, maybe as many as 8 or 10 separate smaller bills.
So
I just want to say that my opponent on that other show...
Have you read the bill?
Yes, I have, twice. My opponent said on the other show he didn't read the bill. He gave up after 30 minutes, but that hasn't stopped him.
I didn't give up after 30 minutes.
Let me finish. That has not stopped him from calling for its repeal. I think it's just as irresponsible to call for the repeal of a bill you admit you haven't read as it is to vote for it if you haven't read it.
Mr. Connolly has not read all the bills he has voted for. Let's be honest with ourselves
no member
here.
of Congress has.
Listen, okay, I'm not in Congress. I was running a company when that bill came out.
Would you read every bill that you vote on?
I would like to.
You will not do anything else. Having worked briefly for the Hill, I can tell you the mountain of paperwork.
Well, listen, for Connolly to make an issue of me not reading a bill when I'm not in Congress is absurd. I read the summaries of it, and the fact is this bill doesn't do what it needs to do. Well, it doesn't address health care adequately, and that's the problem. But look, the fundamental point here is the spending. What about the issues he raised on the bill? Having your child covered till you're 26. Do you like that? I mean, I would prefer it. I have a daughter that fits in that category right now. But you would still repeal the bill? Is that the best thing?
What about preconditions?
No,
pre-existing conditions.
Pre-existing conditions. I'd need to see the language that would be addressed finally in the bill.
We could have a whole program of health care. Can I go to the gays in the military? That's another big issue in the Washington area. Since we're
then we got to get our callers.
Okay.